Hello again, everyone. I'm Dr. Bryan Haugen, a professor of medicine in the Department of Medicine, and I'm also director of philanthropy for the Department of Medicine. And I was asked to talk with you today about lower back pain, which is very common. And also, not only me as a physician thinking about this, but a personal journey of me as a patient with this as well. And I think it helps us think about uh, how do we approach this, both as patients and how do physicians approach this? So, to start with, I'd like to talk a little bit about the anatomy of the back. I think that helps us think about the problems we can have with the back and the lower back in particular. And what we're focused on really is the spine. And the spine has the bones that are part of the spine that basically give us support and protect the spinal cord, which is obviously the main neurologic highway from the brain out to the rest of the body. Um, and there are also discs between each of the vertebrae bones that provide cushion. And obviously, those discs can, as we call, slip or protrude and stick out. And then there are ligaments, which ligaments are things that connect bones together. And those again can be injured as well. And then really supporting the spine are a series of muscles. And those are what can cause spasm in some people's back. And of course, the main player we're thinking about here is the nerves. So we have the spinal cord, and then we have the nerve roots that go out between the vertebrae in these openings. And again, that's sort of protected by the discs. And sometimes when discs protrude out, they can actually press on the nerves. And that's a common cause of back pain when we have disc protrusion. Um, Lower back pain is very common. It's the second most common outpatient visit for a symptom. So it's a very common ailment and commonly a reason why someone sees the doctor. Fortunately, a vast majority of people with low back pain, it's self-limiting, and we can come back to what to do about that. But I'd like to talk a little bit about we as physicians, what we have is what we call red flags that we look at, that we're concerned about. And fortunately, this is less than 10% of low back pain presentation is these red flag causes. So what do we think about? Well, a fracture can be a serious cause that needs more than just rest and some of the therapies I'll talk about for the more common types of back pain. Sciatica, which is actually, again, a nerve problem that people have that we need to sort of rule out in some patients. Spinal stenosis. So that's where the covering, because there's a dura around the cord and then there's fluid inside there. And sometimes if that covering or dura pinches in on the spinal cord, we can have spinal stenosis. And that doesn't usually get better on its own. There can be a tumor, which we would be worried about, and infection. So those are kind of the big things, and there's a whole nother area to search for. But if someone has fever, a history of cancer and new back pain, had a fall, where we could think about a fracture. Those are things that we kind of ask about when we see patients with back pain. Do they have any of those things that maybe it's more severe as far as outcome than would be from the typical causes of low back pain, which is usually, again, strains, muscle problems, ligament problems. For most people who have low back pain, we always think about, well, let's get some imaging. You don't necessarily need imaging, which is good. If you have some of those red flag warnings, and that's again something you can kind of look up, and a lot of sites will have what those red flag warnings are, and can talk to your doctor about those as well. Fortunately, with most patients who don't have some of those problems associated with the red flag warnings, about 90% of people will recover in 4 weeks. It used to be thought, well, you need complete bed rest, but that's no longer the case. What we actually recommend is people stay active while they're doing this. Obviously, let pain be a guide, but you can stay active. Heat and massage really can help with low back pain as well. You can use, if you don't have contraindications to non-steroidal anti-inflammatory drugs, you can use those. Interestingly, for some nerve pain, Tylenol, acetaminophen helps with that as well. Sometimes muscle relaxants are needed, but that's something to talk to your doctor about if you're having a lot of back spasm. And then physical therapy and occupational therapy. Most people will kind of get back to sort of a healthy back once we're over this kind of period. I actually had this type of low back pain that was associated with back spasms, and it lasted for many weeks, and I just couldn't do anything sort of to make it better. And then I actually started getting nerve pain down my leg, and is when I went in to be seen. And I ended up having, because I had a foot drop, I had an MRI of my back, and it was found to have a disc in what's called lumbar vertebrae 4 and 5. A disc had protruded out and was pressing on the nerve. So I talked to various doctors, and the options were surgery, injections, physical therapy. And I decided to start with physical therapy. And let me tell you, physical therapy was amazing. And it really helped me get through this acute problem. But for the nerve pain, I actually got a medicine called gabapentin that really did help while I had the acute nerve pain as we were trying to work me through physical therapy. But now my back is up to full strength, so it's working very well. So how do we keep our back in good shape so we don't have lower back pain? Exercise definitely helps. Yoga helps keep the back healthy. There are many websites. I've actually found the Mayo Clinic website to be helpful with a 15-minute per day exercise. And what I've done is I've done a combination of from the New York Times and the Mayo Clinic and put together my own regimen for keeping my back strong, both with stretching exercises and strengthening exercises. Another thing not to under think about is your mattress. The mattress actually makes a big difference because we spend a lot of time on our back sleeping. And so really, don't skimp on a mattress. Get yourself a really good mattress. I won't be a mattress salesman right now, but there are lots of great mattresses out there. Get a good mattress for your cervical spine. Get a good pillow as well. So I think those are some things to think about. Rule out those red flag things. Most people don't need imaging. 90% of people, 4 weeks, this goes away with staying active, letting pain be your guide, and then also doing heat and massage. Some people alternate heat and cold, non-steroidals if needed. Talk to your doctor about muscle relaxants if you have a lot of back spasm with this. And then again, if there are other concerns, talk to your doctor and you can move on with thinking about other problems and imaging. So I hope you have a healthy back and keep that low back pain down. And I want to thank Dr. David Tanaka through General Internal Medicine who helped me with some input on this and some review material. So I hope that was helpful and I hope you have a great day.